Greetings, everyone. Good morning. Can we share our applause in the chat for Leonard? Thank you, Leonard, for sharing your musical gift with us today. He is a saxophonist, composer, and educator from Milwaukee, Wisconsin. Recently graduated from the Thelonious Monk Institute Fellowship, and after graduating, he moved back to Chicago, where he accepted a fellowship award to teach and perform through the Jazz Institute of Chicago. We are thankful for our partnership with the Jazz Institute. Welcome to Daily Disparities, the impact of COVID-19 and the Black community. Please share in the chat where you're tuning in from so we can acknowledge you on this morning. I am Bianca Cotton, the Diversity, Equity, and Inclusion Coordinator for UCAN. UCAN believes that youth who have suffered trauma can be our future leaders. And we are proud of our approach to ensuring DEI is impactful and unrivaled. For over 5 years, we have partnered with the Institute for Research on Race and Public Policy at UIC to ensure research is disseminated in the community. The Institute promotes and coordinates engaged research on racial and ethnic justice in the United States. This morning, we will hear from the lead author of a report on how COVID-19 has impacted Black and Latinx Chicagoans, published by the Institute for Research on Race and Public Policy. Dr. Claire received her PhD in sociology from the University of Michigan in 2008. Broadly, her research focuses on the social construction of health and disease, the politics of knowledge production, and people's grounded experiences with healing and healthcare systems. She has written 2 books on health disparities among marginalized groups. Let's welcome Dr. Claire. Thank you, Dr. Claire.
Thank you so much, Bianca, for that wonderful introduction. And thank you to Bianca and Claude and Andrea and that beautiful music from Leonard. I'm so pleased to be here to share a little bit of our research with all of you and with the UCAN community. So I look forward to hearing your thoughts about what we found in our research. Share my screen. Okay, so I'd like to begin my comments today with a story from one of the 100 interviews that we did with residents of vulnerable communities in Chicago. So Shirley has lived in the Austin neighborhood of Chicago for her whole life. But during the pandemic, she became afraid to leave her house. Her fiance was infected with the coronavirus at work, and he passed it on to her. She was asymptomatic, but her fiance increasingly struggled to breathe, was taken to the hospital, and then he never came home. I was heartbroken, she told us. I'm still going through it now. The pain's gonna always be there, and I'll never get over that. I'll never heal from that. As she was conducting her interview with us, she was also preparing for her aunt's funeral, who also died from the coronavirus. For most of the pandemic, Shirley only went to work as a cashier and came home. She kept very close tabs on her young 5-year-old son. And she didn't have savings before the pandemic. She got really behind on her bills and her rent. And she also told us that she's seen a lot of suffering in her community, financial instability, people without safe homes, trauma from losing family and friends. Even though she's terrified of COVID-19, she didn't think she would get vaccinated. The interview was before vaccines became available, because she didn't think that the government cared about Black people, and she was very concerned about the vaccine. So this is just one story from one interview of the 100 that we did across all of last year. It's a story of the disproportionate impact that COVID-19 has had on Black and Latinx residents in Chicago. So on this slide, we see the disparities across race for cases, hospitalizations, and death. And we see on the left-hand side of the screen that the Latinx community suffered the highest case rates across the pandemic, which is also true nationally. But on the middle and the right slides, we see that the Black community suffered the highest number of hospitalizations and deaths, again, across the entirety of the pandemic. And this is also true nationwide. Now, Chicago is a majority minority city where white, Black, and Latinx residents each make up approximately 1/3 of the city's population, and the Asian community makes up 6% of the population. And as I've already said, the Latinx community in Chicago bore the brunt of infections. Case rates are similar between Black and white residents, but Black communities suffered much higher hospitalization and death rates. In addition, Black and Latinx Americans have experienced more layoffs, more lost work. They tend to be more behind on their rent. COVID-19, we found in our report, is not only an infectious disease, but it's also exacerbated already profound economic, housing, education, health, and mental health precarity of people who are marginalized on the basis of race, class, and legal status. When news first surfaced in March 2020 that deaths from the coronavirus were concentrated in Black communities, and then in April that infections were concentrated in Latinx communities, City of Chicago and Illinois state officials responded with data-informed racial equity initiatives. Both Governor J.B. Pritzker and Mayor Lori Lightfoot, have dedicated resources to tracking racial statistics on infections and death. They've reduced barriers to testing and monitoring. They've expanded surveillance, healthcare, and vaccination access in Black and Latinx communities. In addition, with her racial equity rapid response team, Mayor Lightfoot incorporated community leaders and local health providers in a task force to focus directly on addressing the uneven impact of COVID-19 in marginalized communities. Many of the people who are involved in the conversation that we'll be having today were directly involved in this task force. Yet, despite all of this effort and the unique incorporation of community activists into the response in Chicago, the toll on Black and Latinx communities has been profound. Between August 2020 and December 2021, we interviewed 100 residents of 3 neighborhoods that were heavily impacted by COVID-19. Albany Park, which is in the north of the city and is a mixed race neighborhood. It's a little higher income. Little Village, which is a predominantly Latinx community, and Austin, which is a predominantly Black community. We also interviewed 65 policymakers, epidemiologists, hospital administrators, clinic staff, and community organizers. Our findings are published in a report titled Deadly Disparities in the Days of COVID-19, How Public Policy Fails Black and Latinx Chicagoans. And I have a link to the report at the end of my talk in the slides. In this report, we explain when and why vulnerable communities' needs remained unmet, despite the concerted efforts of the city and state officials to address racial inequities. Here, I'm just going to go over very quickly 4 of the main reasons that we provide in the report for where needs were really unmet. So first, decades of discriminatory policies on housing, healthcare, and social security, as well as disinvestment in poor neighborhoods, has meant that lower income and working class Chicagoans did not have a safety net to rely on during the pandemic. While middle class Americans with liquid assets, meaning kind of readily available cash, and accumulated wealth, they also experienced disruptions to their employment, yet they had safety nets to help them weather financial setbacks. So this is a slide actually from 2011, so long before the pandemic began, but it illustrates the discrepancy in households in Chicago who have net worth. So here we have a slide where 33% of Black households and 27% of Latinx households in Chicago had no net worth, even in 2011. So that just illustrates that there was already a wide disparity in who had sort of financial wealth to kind of weather financial setbacks. We provide more data on this as well as disparities in access to liquid assets in the report itself, if you're interested. So basically, this slide just illustrates how lower income Black and Latinx Chicagoans didn't have existing financial cushions, and many then also faced barriers to accessing social assistance, which I'll get to in a minute. The Latinx and Black working poor were also made vulnerable to infection because they were most likely to be employed in low-paying front-facing jobs. So these are the demographics of the frontline workers in Chicago. So we've heard the term essential workers quite a bit during the pandemic, and essential workers entail a lot of different kinds of labor. So we often hear about healthcare workers, but there's a lot of people who were doing frontline work during the pandemic, and the majority of them were Black and Latinx. So here we have on the left-hand side of the screen, you see all workers, and then you see all frontline workers. And we can see here that, almost 70% of the people who do frontline work are not white. And then on the right-hand side, you can see that there's different areas in which more Black and Latinx communities are involved in frontline labor. So in public transit, it's almost 60% Black community members who are doing the labor. And then, of course, in cleaning services, you see that there's over 50% of those jobs are done by Latinx Chicagoans. So this just shows us that there were disparities in who was still working, who could not shelter at home, who had to show up to work during the pandemic. Black and Latinx workers are clearly overly represented in frontline labor, and many of them had no choice but to continue to work. They couldn't stay home, they needed the job. In addition, lower income Chicagoans of color also suffered worse outcomes when they were infected because many already faced health insecurity because of pre-existing conditions and lack of sufficient access to healthcare. So here's a slide. Again, this is pre-pandemic because we're talking about pre-existing structural inequalities that Black and Latinx community members faced prior to the pandemic, which put them at greater risk during the pandemic. So here we see a higher number of Black and Latinx Americans who are uninsured. And then you also see who gets their insurance through their work as opposed to through Medicaid or Medicare or through the private insurance market. Both Latinx and Black Chicagoans who already faced financial and health insecurity found that existing vulnerability was compounded by pandemic conditions, which led to higher rates of infection, hospitalization, and death. These conditions, of course, are not unique to Chicago, but Chicago's long history of residential segregation and neighborhood disinvestment exacerbated people's vulnerabilities. So the second thing that we talk about in the report is that at the federal, state, and local levels, COVID-19 has been treated as primarily a health crisis, and it's been fought through a series of public health strategies. However, the residents that we interviewed experienced the pandemic as a much broader crisis associated with housing, food, employment, and childcare insecurity. So, and I'm going to talk about the social assistance that was provided for housing assistance. There were certain programs that were made available for utility and rent assistance, and I'm going to talk about that in a minute. But primarily the bulk of the funding that was provided by the federal government to cities and states was spent obviously on contact tracing, testing, and vaccination access, which of course is important. But people were also struggling from a lot of other side effects of the pandemic. So this is a snapshot 6 months into the pandemic from the Chicago on households that were behind on rent payments. So this is 6 months into the pandemic. 32% of the households who were behind on rent were Black households, and 18% were Latinx households, and only 2% were white households. And then at the bottom of the screen, we also see that there's a difference in educational attainment as to who was behind on rent. which is sort of an indicator of class difference. And then this is another snapshot 6 months into the pandemic of households that had lost income. So again, we see a disparity here between Black and Latinx households on the one hand and white households on the other about who was most behind or who had lost the most income within those first 6 months of the pandemic. And then this is a snapshot of households who had childcare disruptions. Obviously, we know that when the schools were closed in 2020 to 2021, that school year, that it was very difficult for parents to manage going to work and taking care of their children, especially because a lot of the childcare facilities were also closed. So here we see that 24% of Black families and 22% of Latinx families did experience childcare disruptions, and only 17% of white families. Of course, this is something that affected a lot of families regardless of race, but it was very difficult for people who make less money, of course, to find options that were workable for them to take care of their children while they went to work. In the report, we also offer snapshots of different ways in which communities were impacted 6 months into the pandemic. And all of this data is drawn from the US Census Household Pulse Survey. Residents told us again and again in interviews that while the loss of life due to COVID-19 was of course profound and certainly traumatizing, there were a wide array of insecurities that they were facing. For example, when asked how the pandemic affected her neighborhood, one Black woman from Austin told us, within this pandemic, we've had so many other demics. It's a violence demic, a losing my job demic. It's just been so many demics that add on, and this causes mental health issues. In another instance, a Latinx man from Austin explained that while the focus on health issues, that often the focus on health issues obscured broader crises that his community was facing. He explained, we have health issues, of course, mental issues, mental health, drug abuse, alcohol abuse, domestic violence, crime, just like the very mask I wear and you wear. That's what's happening. Everything's being masked, masked, masked. Racism is still an issue undiscussed and hidden. And many residents talked about the ways in which the pandemic was exacerbating not only racial disparities in these things that we're discussing, but also racial violence, obviously. So the third thing that we discussed in the report is as a reason why vulnerable community members' needs were not met sometimes during the pandemic. And the third reason is that the COVID-19 response at all levels of policy development largely prioritize middle-class Americans and the protection of the economy instead of keeping vulnerable communities safe. Businesses were given extensive federal funding, and cities often rushed to reopen their economies while residents were still in crisis and struggling to cope with pandemic vulnerabilities. Labor protections and paid sick leave were often not prioritized, which put poorer Americans at risk of infection at work. Middle-class Americans were able to work from home largely because poorly paid workers continued to labor in factories, shipping warehouses, meatpacking plants, agricultural sites, and along delivery routes. A health provider that we interviewed who works at a federally qualified health center in Albany Park explained to us, our patients were doing construction, housekeeping, working in grocery stores, factories, Amazon. They were in jobs with very few rights as workers. They had employers putting them in harm's way or not letting them follow safety precautions. They didn't have the option of complaining. It was either they did the work or they got fired. In these marginalized groups, there are very few options to speak up and advocate for yourself. So we have a lot of patients coming in that were sick and they were getting it at work. I feel like people were trying to be as safe as they could be. The fourth explanation that we provide in the report for the failure of existing policies to meet existing needs is that much of the social assistance that was made available during the pandemic much of the way that social assistance was made available was actually sometimes difficult for the most vulnerable to access. So we talk about in the report that there were several social assistance strategies that were utilized by federal, state, and local governments, including stimulus payments, increases in unemployment, extensions of food stamps, extensions to some degree of food that was made available through school programs, and rental assistance. And yet we suggest that the social assistance was often really only constituted harm reduction when more extensive resource allocation was needed to offset existing structural inequalities. Also, financial and housing support were offered in a reactive fashion after residents had already experienced mounting debt, job loss, and financial insecurity, which often was very difficult for people to manage. On top of that, residents faced bureaucratic barriers in accessing financial and housing support, or payouts were extremely delayed. So oftentimes people had already they'd already moved out of their unstable housing because they were so concerned about being evicted or having some negative relationship with their landlord. To access housing and financial support, residents had to demonstrate an already existing vulnerability before resources could be allocated. Implementing social benefits through means testing, where the burden rests on residents to prove their eligibility, is part of a decades-long tradition in the United States that's designed to prevent possible fraud of the system. But implemented this way, social benefits include complex and often cumbersome requirements and bureaucratic proof to access. And this can create very harsh barriers for the most vulnerable. Barriers included language difficulties, lack of translation, technology and computer obstacles, short windows of time to produce proof, delayed delivery of funds if applications were accepted, and other obstacles associated with childcare and work schedules. So these statistics are actually from December 2021 and don't include the last round of housing assistance. But this showed, as of, I think it was December 1st, the number of households in Illinois who were behind on rent, the applications that had been reviewed, and the number of applications that had been approved. So again, we see a real discrepancy in terms of the need versus what actually was paid out. In addition, tenants had to rely on their landlords to be willing to provide documentation. For this Latinx resident from Albany Park, this became a barrier. He said, "I don't have legal documents. It's very complicated to get any kind of support because we don't get stimulus checks. They wanted me to talk with the landlord so that they can send him the rental assistance. But the problem is that the homeowner doesn't want to provide that information that they ask for because the homeowner has to give his tax number." Another Latinx man from Little Village explained all of the bureaucratic barriers people faced in filing for emergency rental assistance. There were a lot of different deadlines with a lot of documentation required to get housing assistance for rent. You needed to show contracts signed by the landlord, and a lot of families don't necessarily enter those contracts. They pay month by month. So getting certain documents and getting them in a short period of time before the money runs out or before the application period quits is a barrier. So a lot of people have informal housing arrangements in Chicago. That's what makes their housing affordable. But the requirements for accessing rental assistance were often unavailable to people who had such arrangements. This is just another peek at that slide that shows that discrepancy. I've continued to conduct interviews this semester, and the residents that I've spoken with have also expressed frustration with the cutting off of pandemic relief before the pandemic is fully resolved. Many feel as though they've been abandoned to their conditions despite ongoing disruptions to work, ongoing infections and deaths, and ongoing debt and insecurity. One Black resident of Albany Park explained how angry she was that her unemployment ended in September 2021, saying the pandemic, like it's not over. This is, back in September, of course. Cutting off unemployment was like a slap in the face. It is what it is. It's America. But I just feel like this time period has showed us how this country really, really sees its people as disposable. And a lot of people have expressed concerns about feeling as though the country is moving on and they're being left behind. The racial equity measures put in place by stakeholders involved in the Racial Equity Rapid Response Team were in some ways hugely successful. Epidemiological data was successfully deployed to direct testing, contact tracing, and vaccine programming, and resources to vulnerable areas in the city. In addition, the city employed a hyperlocal lens that drew on community organizers' local knowledge and connections to achieve community trust. As a result, City of Chicago officials were able to track positivity, hospitalization, and death rates at census tract levels and respond to surges and outbreaks with local supplies. Further, Chicago officials fought to achieve equity in vaccine distribution once vaccines were made available. These are hugely laudable achievements. And yet historic patterns of inequality and segregation, lack of priority given to financial and housing assistance, and means-tested approaches to social assistance meant that many Black and Latinx Chicagoans suffered the worst impacts of the pandemic. And vulnerable communities will continue to struggle to recover from the crises that were intensified by the pandemic as middle class and wealthy communities recuperate and move on. In other words, this report suggests that exacerbated inequality will be an enduring legacy of the COVID-19 pandemic. Thank you so much for your time today. The report is available here. And now I'm going to stop sharing my screen, and I have the wonderful job of introducing Claude Robinson, who will be moderating the panel today. So Claude A. Robinson Jr. is the Executive Vice President of External Affairs and Diversity at UCAN. In addition to this work at UCAN, Claude sits on the board of directors for the Illinois Collaboration on Youth, as well as the Attorney Registration and Disciplinary Commission. Claude has won numerous accolades for all of his work with communities, including awards from the former City of Chicago Mayor Richard Daley, Miss Illinois Leadership Award 2001, and WGN TV Channel 9's 2000 Unsung Hero Award. So thank you so much for having me, and thank you, Claude, for facilitating this conversation.
Great. Thanks, Claire, for the introduction and all the work you put in with the rest of your team around this important report. And UCAN is delighted and just glad to be in partnership with you over the years to ensure that this research gets out to communities so that it can be helpful and help with improving quality of life. So today we have 3 panelists with us. Ms. Darlene Hightower will be joining us, and she is the President and CEO for the Metropolitan Planning Council. Good morning, Darlene. We also have Ladarius Hunt with us, who is the Senior Director of Community Engagement and Health at Westside United. We did have to apologize. Dr. Maya Green, the Chief Medical Officer at Howard Brown Health, had an emergency pop up, so she won't be able to join us today. She was ready to just share with everybody. So I told her we're going to miss her today. So, but Darlene and Ladarius, let's get to it, okay? Tell us you're from Chicago. This is our opening mystery question without saying you're from Chicago. So Darlene, can you answer that first?
I would say Michael Jordan, Bulls, and the Bears.
Okay, fantastic. Ladarius, how about you?
No ketchup on the hot dogs.
Okay.
would be one. And deep dish pizza would definitely be the other.
Okay, great. And for the audience, although we can't see you, we want you involved and engaged in this as well. So hit that chat and get the chat live, all right? Tell us you're from Chicago without saying you're from Chicago, all right? So for our first question, Darlene, how has COVID-19, this pandemic, affected you personally?
Yeah, I mean, it's kind of hard to separate the personal part from the professional because while I'm currently CEO of the Planning Council, there's some weird feedback. I was with Rush University Medical Center when the pandemic hit and overseeing their community engagement work. I was also on the city's racial equity rapid response team, so I got a lot to say about that. But it was really hard, you know, like watching people of color bear the brunt of this epidemic, from getting COVID to dying from COVID, and seeing that data and watching it. It was really hard. And knowing that no matter like how hard you try to get information out and provide resources, you're trying to fix a problem, as Dr. Claire said earlier, that's really rooted in larger systemic issues. So I'll stop there.
Okay, thanks, Darlene. And we'll touch a little bit on the rapid response to racial that as well. So Darius, how about you? How did it affect you personally?
Well, unfortunately, I ended up getting COVID twice. So it affected me personally. The first time, and this was pre-vaccination, it was honestly, it was a little scary and a little emotional because I did not know what the symptoms were going to be. Everything was so fresh and so new, just trying to get a level of research and understanding of what was not only going on with my body, but how to kind of fight it and affect it. And then, having it the second time, not as bad, but having a different variant of it, but still not really knowing and having that understanding. So not necessarily as frightened, but from before, but just having a different level of knowledge and understanding. And on another personal note, living and growing up in Austin, as Austin originally from the outset of COVID had tons of cases, but really had the most deaths. That really hit the Austin community hard. All of the community organizations really kind of pushed themselves together and pushed everything into the table to try to, combat what was going on with COVID. But just having some of our heroes and sheroes in Austin having to deal with that and the effect of it really kind of took a toll on the public.
Okay, how about professionally, Ladarius, given being Westside United and leading community engagement?
Sure. So from that perspective, really it affected me to really kind of tie up my boots and really kind of hit the ground and working with other community organizations like a UCAN or Austin Coming Together or a Garfield Park Community Council, any and all of the organizations on the West Side Resurrection Project, anyone who needed resources, Westside United has been there to really push and find out what are the resources that were needed just from the COVID perspective, whether it was PPE, education around the various variants, if you will, that was been kind of taking a toll on it, and just really getting folks to really understand that, look, you need to understand how COVID could affect your life physically and mentally. And we're going to give you as much information as we know and as we have to kind of push that forward. So really just trying to buckle down and buckle up with other community organizations on the West Side to really, save our people and really kind of get them, keep them as healthy as possible.
Thanks, Ladarius. And Darlene, how about you? You were saying you really couldn't distinguish between personal and professional. Can you expound on that a little bit?
Sure. I mean, I remember seeing the data that came out from, I think it was WBEZ, that showed that though African Americans made up 30% of the population of Chicago, they were 70% of the deaths at that time were African Americans. And, I'm looking at myself, I'm looking at my family, and just thinking, wow, like once again, we are hardest hit. And then I'm also thinking to myself, but none of this is surprising. We had been working in health disparities for quite some time. And when you look at how things like obesity rates, chronic disease, educational attainment, quality employment, how African-American communities and Latinx communities, there were deep disparities for us in those areas. And so COVID-19 just exacerbated what had already existed for us. So the numbers were really just telling a story that we had known about before. So none of us really should have been surprised because these inequities, the health disparities have existed for a very long time. And so yes, professionally, it's like, okay, like Ladarius said, we got to double down, roll up our sleeves. What can we do? Like, this is a crisis, all hands on deck, let's go, And then personally, it's like, man, I'm a person of color. Like, this is impacting my community. I live on the South Side, like all of these things, it becomes and still is a very emotional topic.
Sure. And Darlene, I remember after the George Floyd tragedy that happened, And Alderman Scott and other elected officials called everyone to help with the looting and the rioting and things like that. And I remember, I saw you with a rake and a broom, doing everything that you could to clean the community back up and make it clean and healthy again. So definitely not only by title, but leading by example as well. And Ladarius, our conversations around, young people and trying to help them understand that they do need to be involved, have masks and take care of themselves instead of thinking they're invincible like a lot of them did. I know I thought I was invincible when I was too young too. So yeah. So I wanted to touch on the report a little bit now and ask you what was most compelling about the Deadly Disparities report. Ladarius, can you speak on that?
Sure. Actually, I took a couple of notes. I noticed in the report, and I don't know if we went through some of it, but particularly around the behavioral health and the amount of behavioral health facilities or clinicians that we have on the West Side. If you look at the report, there's one behavioral health center in the East-West Garfield Park area that technically is supposed to serve East-West Garfield Park and Austin. Austin has 90,000 residents. And between, and then you have East and West Garfield Park with another 30 to 40,000 residents. So you explain to me how one clinician or one center is supposed to work with 150 or 100, 120 to 150,000 people at one time with their trauma and behavioral health. And this is pre-COVID. Now we're talking about now we're talking about during the pandemic when you have lack of food insecurity, people can't, the rental insurance, everything, they can't pay their rent, they're losing their jobs, or some people have even had to quit their jobs just because they had to stay home and take care of their children. So there was a lot of disparities that I saw through that. And then the overall income loss that I saw from one of the slides really captured my attention. I mean, even, white people in the city of Chicago, income loss was 39%, but then you look at the Black and Latinx, that's 65 and 68%. You're talking about a serious loss of income that's going around that you're not going to get back. That's not going just to magically return even when the pandemic leaves. So we have to be able to come up with smart solutions and thoughts around how we can really get this going. So those were the things that really stuck out to me right away.
Okay, thanks, Ladarius. And Darlene, before you answer it, I wanted to also thank Congressman Danny Davis and Nikki Harvey and Tiama Romero for continuing to lift these issues of health inequities in child welfare and across for Black and Brown youth as well for their continued work. And I would invite everybody to visit the Congressman's website to see how they are really trying to get policy focused on changing some of these disparities. And so, and Darlene, can you speak to, what was most compelling for you?
Sure. So there are a couple of things, and I wrote down some notes. So one that I could not agree with more was this notion that COVID-19 exacerbated challenges that were already in vulnerable populations. And I said that a little bit earlier, like the hardest hit communities were the ones that have always been hardest hit when we're talking about disparities, income, education, and so COVID-19 just made things worse for populations and people who are already challenged. And then second, this idea or notion that there was no safety net for certain folks, for Black and Brown communities during the pandemic, which made their outcomes worse. I think I couldn't agree more with that. Like the having no safety net, and then you're hit with this huge challenge, you're hit with the pandemic, of course, it's going to make your outcomes worse. And then there was another idea that the responses that were put in place, or the way that we thought about addressing the pandemic, there was an element of privilege and classism in that, right? Like some of us had the privilege and opportunity to work from home, others did not. And like what safety protocols and help were we putting in place for those who weren't, able to work from home, who were essential workers and had to be out, going to work and providing services to folks. And so I agree with that too, that in some ways, how we thought about relief from the pandemic was not as deeply rooted and grounded in the realities of Black and Brown communities as it should have been, with the exception, as Dr. Claire said later in her talk, of some of the work that came out of the Racial Equity Rapid Response Team. The last thing I'll mention too, and it's kind of alluded to in the report, one of the things that struck me is just the vulnerability of our public health system, and the fact that when the pandemic hit, we're trying to patch together a response with resources from hospitals, community-based organizations, government. But had we had deeper, stronger, deeply rooted public health systems within the Chicagoland area to begin with, then our outcomes may have been even better. Not to say CDPH wasn't working hard, they did amazing work, but people have to realize that there were resource challenges with our public health system.
And I wanted to ask a different question, because if you think back to when COVID first came into being, say March of 2020, it was that February, the All-Star game was here in Chicago, everything was going, and then all of a sudden the world changed. And there was at the time, nurses and healthcare leaders were seen as heroes. And I actually was driving to the Brickyard Mall the other day, and there's a sign on the hospital there that says heroes work here. So at that time, that was the sentiment. But then now there's a total different sentiment towards our healthcare workers, where they're seen as not as helpful around the virus. Can you speak to kind of how that changed?
Sure, I can jump in on that. Having worked at a hospital, I think you're right. There really was this swell of support and outreach for our nurses and our doctors and our PCTs and community health workers. People were really rallying behind them, but I think like everything else, there became a moment of fatigue. And everybody was just tired of the pandemic in general. And so I think that impacted people's sentiments toward healthcare workers, which was really unfair because folks were still doing the work, showing up, providing the best care that they could, dealing with the heartache and heartbreak of people losing their lives, and you kind of watching that, or being out in community and trying to educate folks and provide resources. People were out doing the work. And so I would hope that we would come back to a place of really recognizing our healthcare workers as broadly defined as we want it to be, who have really been in the trenches, rolling up their sleeves and putting in the work to help people.
And Ladarius, I was going to ask a different question around just the politicization of COVID overall. How did you deal with that as a leader?
That's a great question. A little bit of a loaded question, but definitely a loaded question. I would say this: to kind of go back to what Darlene was talking about and peel back another layer of it. I think it was the combination of the history and the research that was being done throughout the cases of COVID. So obviously, with COVID just kind of being dropped on us, if you will, from that December 2019 to March or February 2020 conversation, there wasn't enough research or wasn't enough information around it or education around it that people could really get a real sense of their own knowledge of it. So because of social media and other outlets, you have people just spewing, some information, some total misinformation, people just saying things that they just don't know. And that did, as the person just said in the chat, made a huge difference and a huge mistake for everyone. But also we do have to recognize the history of how Black and Latinx people have been portrayed or used in the medical field. So there was already one side versus the other. There was already a battle that we were already underlined, that was already there before even COVID kind of approached it. So with that, as a person said in the chat, the historical trauma that we've all kind of experienced at that hospital level, it was already politicized from the beginning. So we really didn't have a choice. So what I try to do, and what a lot of the community, the CBOs and other community organizations tried to do, was first provide the baseline resources that everybody needs. Try to provide food, clothes, and shelter, and PPE. So that's the first thing that we tried to do. Then as we learned from the hospitals, from the CDC, from Pfizer, like I've had meetings with Pfizer and all of that, to just really get a better understanding of what COVID-19 is, what it's about. And as we led down that road of vaccination, what was that about? Because that was also a big politicized issue as well. So trying to get some level of education and understanding around it first was the key for me. But then as we got some strong, understanding, really starting to reach out to members of the community, residents, have community conversations, have Zoom calls like this, really started to promote and give people an understanding of what was out there. The first thing I would tell people all the time is, look, I am here to give you the best information so you can make the right decision for your family. I can't tell you what to do, but I'm going to give you everything that I have in my power to give to you to make the right decision based on the information that we have around COVID and the vaccination.
Yeah, that last part is super important. And then also with that, like I remember working with the communications team on putting the information together. Like, don't speak CDC to me, I don't understand CDC language, like make it plain so I can understand what's going on. And really, working with our doctors and nurses and other professionals and people in the community to boil that information down so that people could get the real on what this was about in language that they could understand. So that was some of the work as well.
You want to hear something funny? My mother has been a nurse she was a flight nurse in the Air Force, retired as a captain, and then she's been an RN. So Darlene, she used to be at Rush as well with you for a little while, and was doing in the schools, the clinics that you established and everything. And the other day I was talking to her, and she looked at the flyer and said, "Dr. Maya Green, that's my boss. How's she gonna be on the panel and everything?" I was like, I ain't know, but think about, how small the world can be. But it's great to have leaders like yourselves really focused on getting the message out, and a preventative message so that people can make informed decisions around this in particular. So given now that the variant is somewhat, and I guess I'll cross my fingers, somewhat under control, and that there'll be mask mandates will be lifted and things like that. What policies do you think are most important at this point in time? I can see y'all thinking.
Yeah, I think that's a really good question. One of the findings from Dr. Claire's report was about, sometimes the policies were more focused on retaining finances and financial security than they were in helping people or, focused on people's well-being and lives. And I hope as we move forward that there's a shift and a change in that. Like, I understand the balance of wanting to continue to be economically viable, but we have to also focus on people's well-being. And so as we're coming out of this and we're thinking about masking requirements and all of that, I just want people to be safe. And I hope, we're putting policies in place that think about people, and saving people and helping people, because we're not done with this pandemic yet. And I worry that some of us think we are and are acting as though we are. And I'm worried that there will be a corresponding uptick in cases.
Okay, how about you, Ladarius?
Actually, in terms of policy, I would love to see something that is a holistic approach to generational health, because as people say, health is wealth. So we really need to really focus on that. We have to. There's no way for us to continue on the path that we're on from the Black and Latinx perspective if we're not taking care of ourselves with our blood pressure or diabetes or hypertension or lack of food. I mean, anybody on this call that's from Garfield Park knows that you don't have a grocery store right now. And as a person who lives in West Garfield Park, I know that specifically. So, and everybody doesn't have a car to be able to go. So now they have to go to the corner store where the access to fresh food and produce is just not there, and it's not as vibrant. So I'm hoping that whatever next policy information kind of comes down really focuses on a holistic approach to generational health.
I think that's a really great point, Darius. And I would add, just kind of circling back to the report, thinking about COVID as something that's broader than health. Where are the policies around affordable housing, access to, quality jobs, in addition to healthcare? How are we putting a stronger safety net in place for people, knowing now what we know, how a pandemic can really, exacerbate existing problems? Let's start putting policies in place to get at the root of why people are vulnerable and why Black and Brown communities were hit the hardest by COVID-19. That would be a really good place to deploy our thinking and our resources.
Thanks, Darlene. Ladarius, how do you relate to young boys and men around this issue of their own personal health? Because you spoke about diabetes and high blood pressure and heart attack and stress. Mm-hmm. But what I find most times, or I'll say many times, is that a lot of men and young boys just think this does not apply to me. I'm good. How do you break through that?
I think what I've been able to do with some of the conversations I've had is to just really be, first of all, you have to be transparent about your own stress and your own even trauma, or even just what you're dealing with on the day-to-day basis. I think you have to be able to, I think one of our issues is that we don't have enough strong relationships male to male to be able to pull back some of the layers of the stress and the trauma that's there. So people are not, or unwilling, I will say, to open up. So what I try to do is open up first to let them know that it's a safe space, and to be able to say, well, if he can share his issue and his situation, then I can share mine. I think that's kind of helped any type of story, or anytime I come on a Zoom where I'm talking to people, or even when I'm talking to people day to day or passing out face mask or whatever the situation is, I tell them, I need you to wear this because if you have an older person in your home and you somehow get COVID, that person might not be here next year. So you need to understand how it affects everyone in your own circle. And you're gonna think you're good, and even if you're asymptomatic, you're fine. But it's not always about you. It's about everyone around you and everybody who cares about you and everybody you care about. And if I found that if you make it personal and can find a way to tap into what's going to personally help them and see them grow in the long run, that they're more perceptive to what you're talking about and how to help out in this COVID era that we're living in.
Darlene, did you want to comment on that one? And I wanted to have the gender focused question on Black men or Latinx men in particular, and how do we break through just the attitude of taking care of yourself.
Yeah, I'm just, co-signing on everything that Ladarius said. I mean, I think he had raised wonderful points. And I think that one-on-one conversation and being real with people and sharing your own vulnerability is really important. And then also showing people how what they do impacts and affects others. I think that was really powerful.
Okay, let's switch up real quick. We're getting close to our question and answer time and the end of the panel. What high school did you go to, Darlene?
Making me think a long time ago. Kenwood.
You went to Kenwood. All right.
Time ago.
All right. And Ladarius, where'd you go?
I went to 2 high schools. I did graduate from Providence St. Mel in West.
Okay, Providence St. Mel. Good. In the chat, if people can put in there, are you a coffee or a tea drinker, or just plain water? Put that in the chat as well. So y'all stay with us. We're almost done. So my other question would be, why do you think there was so much opposition to the vaccine? When I'll make it personal, my mother's a nurse. I'll trust her, even though we argue about anything and everything. When this came up, I was like, this isn't going to really impact me. I'm good. I'm healthy. And then I asked her, should I get the shot? And she was like, of course you should get the shot. And I'll go, well, what about it hasn't been enough time to see if people are going to get sick and, all the side effects and things like that. And she was like, get the shot and make sure everybody else gets it as well, because this happens all the time. So I was going to ask you just around that, why was there so much opposition to the vaccine then and even now?
Yeah, I was going to say there's still opposition to getting it, like all across the country, you have factions of folks that have taken it on as like a personal health issue thing. I think that there are a lot of reasons. When the vaccine first came out, my observation was that you had some folks that were like super excited. Yes, this is going to end the pandemic. I'm definitely going to go, get vaccinated. And then you had other people that were like, what is this? Like, I don't know what's in it. I don't trust the government and other folks to put stuff together. I don't want to do it. It's going to have terrible side effects. So you kind of had this like immediate response within African-American communities. People would say, well, like, I don't want people experimenting on me. This is just like the Tuskegee experiment. They're not telling us the truth. I don't want to put anything in my body that I don't, know what's in it. And so I think because of racism and, the historic mistrust, which is well-researched, well-documented, and is true, people were very skeptical this go around about the vaccine. And so the historical perspective, the mistrust of healthcare and the medical system, I think is a reason why people were very hesitant to get vaccinated.
Thanks, Darlene. Ladarius.
I would say ditto to everything Darlene said. And I think another part of it was the fact that there were 2 types of vaccines and how they work in your body. I'm not going to say it didn't. I'm not going to say it hurt, because you kind of needed, science and research needed to experiment, if you will, on what was going on. But I think the fact that we have the mRNA and then the other type of how the J&J works, those types of vaccines and how they work and go into your body and how it makes the protein spike. And as Darlene mentioned earlier, the CDC language or the alphabet soup that is medical science that, the 99% of us have no idea what they're talking about, did not help the situation at all. And then you compound that with, historical trauma, already the social unrest. Remember, we were going through the COVID and social unrest all at the same time. Like everything was going on, and it was really highlighting and spotlighting those social determinants of health that people are already dealing with. But then when you get to the vaccine, it's like, hold on. So now we got this vaccine. It only does this. It'll help you here, but it won't help you there. So I think flushing out everything that the vaccine was about, and then the research, as we continue to have the revolving door of research, people are luckily being able to educate themselves further. But that initial, okay, this is what we have, and this is what's going on, I think it was frightening to folks mostly, and obviously put some people off because of the historical trauma and the systemic racism that we mentioned earlier.
I think there was also a lot of misinformation, intentional misinformation. I remember putting together a lot of FAQs for the community, just addressing misinformation and rumors. Oh, if you take the vaccine, you're going to be sterile. Oh, it's going to impact your heart. All of these things, all of this misinformation, I think has caused challenges as well.
Agreed. So one last question, and then we're going to go. We have 3 questions in the Q&A section, and if you have any other questions, we'll put them in the question and answer so we can try and have them answer before our time is up. What final thoughts do you have just surrounding the report overall? So Darlene, if you could start, and then Ladarius.
Can you ask that again? I got caught up in the chat. Sorry.
See, look, I'm trying to stay here instead of down. I see the chat is live. Coffee, tea, water, the whole 9. So what final thoughts do you have just around this impressive, informative report?
That this is really bigger than COVID-19, that this is really about systemic barriers and inequities and disparities in social things like access to education, access to quality jobs, safe communities. It's bigger than COVID-19. COVID just exacerbated problems that we've always had and we haven't been able to fix. So that, I think that's the biggest takeaway.
Okay, thanks. Ladarius?
Yeah, I think what we've tried to do, or what I've tried to do, is make sure that any language that I speak or anything we talk about, that it is supported by some form of data and understanding. I don't want to be a person that's providing misinformation to people. The trauma, the systemic racism, and the social determinant of health, along with the violence, have always been there. And now COVID has really put a serious spotlight or highlight on that. Just in the way that we talk to each other and the way that we speak to each other because of COVID is now different. I had a person on a Zoom call say, I would prefer that no one ever use the word target anymore because Black and Latinx people have been targeted their entire existence in America. So let's try to use other words that bring that out. And I don't know if without COVID, we would have gotten to that point. I'm not sure, but it's just our revolving level of understanding and education that we really need to have so we can see through, we can navigate ourselves through COVID and come out on the other side with, like I mentioned before, a generational health strategy that will help everyone.
Great. Thanks, Ladarius. So let's jump into our Q&A. We have 5 questions, so we may not. I may not ask you to answer all of them, both of you. But the first question was from Teresa Anderson. Thank you, Teresa. What more do you believe could have been done to impress upon communities the necessity of limiting socialization outside of what was necessary for work? It's pretty.
Yeah, that's a tough one, right? Because I know as the pandemic was unfolding, we were getting information about social distancing, stay with the people that are in your home, like don't go to like the large events and stuff like that. And I think all you could do was get information out about how that kind of activity increase your risk, to get COVID-19. The messaging, I think, was really important, and I know a lot of messaging went out. I think getting messages from health systems was great, but I think maybe if there were more like peer-to-peer conversations about it, because people do stuff in line with their friends and with their families, and so if there were more like real conversations peer-to-peer about the risk of certain behaviors, that could have been helpful. But back to what you all were saying earlier, some folks just felt invincible, like no amount of talking to them peer-to-peer, anything,
Yes.
helped. So.
Okay, thanks. And the second question we have is from Ishmael Enriquez. Thanks, Ishmael. The question is around community leaders and politicians, as well as community-based organizations. What are we doing to strengthen the Black and Brown communities to have better resources and equity health-wise? As we know, this is nothing new. So Ladarius, can you take that one?
Sure. I think what a lot of community-based organizations are doing now, which we might have not been doing a good job of before, is working together, recognizing that we're all in this together. And whether you live in Little Village or North Lawndale or South Lawndale or Alston or Humble Park, we're all in this together. And we needed to come up with a strategy that really showed that. And also with that, pulling our resources together, because there were times where we would give out, PPE and say, hey, is there any other organization that you know of that needs this? And they would say, yes, this organization. I'd get a list of like 7 organizations that needs PPE. So let me run over here and try to and give it to them. But with that led to other conversations like, okay, now you guys are in this area. You're in Humble Park. Let's have a conversation at the library about why COVID is the way it is, and why the vaccine is happening, and how you should use it. Continue to be informed. Also, I felt like one of the best strategies we had was using people who live in the neighborhood to talk about their shared experience. And I'm talking about healthcare physicians, doctors, dentists, anyone who was close to the medical field, or anyone who was a community leader, to come on and speak about not only their experience, but the research that they had done. Really helped provide and really helped our conversations as we kind of started knocking on doors and moving forward with COVID.
It's so true. I know that at UCAN, when the violence kicked up, and while the virus and all the social unrest, and it really put us in a different place of how we approach community, ensuring the PPE was out, hand sanitizer, the spray, all of that. And to your point, Ladarius, credible messengers or people with authority in community were at the forefront of that. It wasn't the CEO or board members, involved in that. So another question, what do you hope people take away from the report? And how do you hope it will influence policies and future public health issues? Thank you for the question, Kristen.
Yes, I think we touched on that a little earlier, like hoping that this report and the way that COVID has affected Black and Brown communities becomes even more a way or an example of what needs to be done to make things better for people overall, like really thinking about our vulnerable populations and why they're vulnerable, and what we can do from a policy standpoint to improve people's lives, to improve the quality of their lives, so that when things happen, it doesn't automatically devastate a community, but a community is able to be resilient and to withstand things. And that comes from communities and people having the resources that they need to live quality lives. Where's the policy around that? Like, let's focus on that.
Sure, Darlene. And also, do you think that we could have members of the audience be aware of what's happening with the Rush BMO Institute of Health Equity? I mean, a lot of the research is out. I know Dr. Ansel just spoke about racism in the New England Journal of Medical Health and things like that. How can they learn more about the Institute?
Well, Claude, I now work for the Metropolitan Planning Council. However, the BMO Rush for Health Equity is an amazing group, brings together researchers, community, clinical efforts, academic efforts, like all with this goal of improving health outcomes and, really having people in community be their best and healthiest selves. And so there's information on the Rush website about the Institute.
Thanks, Darlene. Go ahead, Blair.
Oh, thank you. I just want to say something really quick for those of you who are either unaware about what hospitals have to do. Every 3 years, a hospital has to do a community health needs assessment. You can find every hospital has to do one, and you can find them on their website. Make sure you take a look at that, see what those hospitals are saying that they're supposed to do and going to do, and push them to do it. And that's what you should do. And if you do that and you push them in a way and also provide some solutions to problems that they haven't been able to kind of figure out, you will see a real change in that area. But I wanted to just let everyone know, it doesn't matter what hospital it is, community health needs assessments are on their website, whether it's Rush, Amita Health, Lurie Children's, it doesn't matter, they're all there. So take a look at them, get some education about what they're saying already about what your community needs are. And if you disagree with them, push back and let them know.
The host muted me. Don't have me find out who's the host, but so Lauren Taylor asked a question. She said, do the panelists know Black college grads are the most vaccinated group in the US? And how do class divisions in the Black community affect efforts to convince people to take mitigation measures?
I did not know that, so thank you for enlightening us on that. That's a really important fact. And I appreciate raising the class question as well, because that data about Black college grads being the most vaccinated kind of highlights, potentially some of the differences of class within the African American community, because we're not a monolith. A lot of us are, we're not all living the same lives. So I appreciate that difference. But Ladarius, what do you think?
I read that in the chat and was amazed that I saw that about the Black graduates. I think that what we need to do, and this is a difficult thing, whether it's Black, Latinx, white, I think we have to be able to talk to each other and not just to our own groups. So I can't just sit around and talk to the college graduate Black person. I have to talk to every Black person, no matter where they are, meet people where they are to get a better understanding of how they view what's going on with the pandemic and the vaccine, and then be able to discuss what issues they have. And then that way we can, get closer together instead of moving further apart.
Yeah, I couldn't agree more. It's like, listen and talk with empathy, not judgment, because it's so easy to think you have all the answers. Ladarius, you've been doing this work, you know, in the community. I was working for a hospital. Like, you have information and access to stuff that some people may not have, but so what? It's like, meet people where they are, you know, talk in language that people can understand, listen with empathy to help and to not judge. And I think that would help us go a lot further.
Great. So one more question before we turn it over to Yvonne from the Institute of Race Research and Public Policy. One more question would be around how have you taken care of yourself through all of these pandemics, social unrest, the COVID-19, the different variants, political instability, economic. How have you taken care of yourself as leaders?
I'll go first, Darlene, if you want. That's fine. I would say for me, what I've done is the first thing I had to do was really look inward and figure out exactly how this was making me feel and how it was impacting how I did my day-to-day work. I think once I was able to understand that, I was able to kind of change my thought process and language about how I speak around all of these issues, whether it's systemic racism or COVID-19, or even as people push around the vaccination and the process. But like I said before, continuing to meet people where they are when we have conversations, and also recognizing that I don't have all the answers. So I need to get back to folks with some form of answer, or even talking to other people around how, from a community perspective, we come up with a really strong, serious strategy that people are for, instead of being totally against it. Like, because I think when this first started, everybody was just against. And then, you get more people on your side. People are like, okay, now we're a little bit for the vaccine. Let's just kind of make that happen. But there's still people that are always going to be against, but that's okay. And also understanding that is okay, but making sure that what comes out of your mouth is the best research and education moving forward for that that misinformation that comes out around.
Yeah,
Okay,
and
thanks for that.
And for me, like, I've, just keeping it at a more personal level, it's, taking care of both your physical health and your mental health. It's been a very, very, very challenging 2 years. And so, like, physically, I'm a workout person. And so having that physical activity has been really helpful to deal with stress, whether it's walking, working out, whatever it might be. That's been very helpful. And then on the mental health, spiritual side, I'm a person of faith. And so, my prayer life has been central to me being focused and being able to operate and be productive. So I would say, those two things. Oh, and then the last one, when all else fails, something really good to eat to comfort myself has been very helpful as well.
Okay, great. Darlene, have you heard Tamla Mann's song when she called "Help Me"?
No.
It'll
Take
have
a
you,
listen. Okay.
It'll take you
I'm
there.
going to Spotify. Thank you.
She was serious about that one. And last question, what's your favorite restaurant? That's our closing mystery question. What's your your go-to favorite restaurant? And it can't be Dave's Hot Dogs. All right.
So first of all, I like eat way too much and love a good restaurant, but my favorite as of now is one of the favorites is Virtue in Hyde Park. It's like Southern comfort, Black owned restaurant, always delicious, warm environment. And it's a go-to for me.
Got you. Ladarius?
Well, since I'm a little younger and I still don't eat the best food in the world. I'm only saying that because I don't eat the best way I should. Not to say that, I'm young, because I'm not that young. But I would say I do enjoy, when I'm when I'm with my family, or if I want some good barbecue, I still enjoy Wiley's barbecue on Madison. I still, I love Wiley's. I love deep dish pizza, so a Giordano's or a Gino's East or something like that. I'm a fan of both Harold's and Uncle Remus. I like the fact that they're different, actually. I like the tang of Remus compared to the, little bit more tomatoey of Harold's. Like, I get it. Like, I understand it. I'm not going to tell you which one I like, because I'm sure all of you are going to hang up on me, but I'm not going to go there, but I enjoy them both. That's what I'll say.
All right. So, Yvonne, if you can come on real quick. And I wanted to thank both Darlene and Ladarius for the time today and sharing your insights, and also to Claire for presenting this very important information around the deadly disparities of COVID-19 in the Black community. We wanted to bring this during Black History Month and have a focus on the Black community in hopes that we're enlightened and more aware of what's going on, so that we can make more informed decisions for our families and for our communities as well. So I want to turn it over to Ivan from here. Thank you.
Yes, thank you. Yeah, thank you as well, Claude. And first, I'm sure there'll be a lot of love as well in the chat. Thanking our panelists, Claire Laurier Dakota, Darlene Hightower, Ladarius Curtis, and also to you, Claude. Thank you so much. I also want to thank folks who made time to attend this event. It was an honor to be here in this virtual space with folks today. I think it was a powerful conversation. It brought to life issues raised in the report, how communities come together on the West Side to support each other. I think we can all agree that there's a lot of insights that are gleaned from today's discussion. And so I think if there is something that's staying with folks, please take a moment and add it to the chat. A couple of the things that are staying with me from the conversation between Darlene, Ladarius, and Claude is that reminder of the ways in which existing inequities have for a long time blurred the lines on the West Side and other Black and Latinx communities between that personal and professional lives, between work and community. And within that, the important role of community leaders in supporting the neighborhoods and given that mistrust in our health and government, and also the ways in which that has brought communities together in solidarity to support each other. I heard a lot of that in many of the comments today. I think, another thing that I'll be thinking about today was the way in which that lack of resources that existed well before the pandemic and Black and Latinx communities meant that this COVID-19 crisis only made existing challenges worse. And so the ways in which we knew that resources were needed well before COVID-19 and they're still needed now, especially around that piece on generational health that gets at the root of vulnerabilities that was brought up a couple times. And so I think just thank you all again today for joining us for today's Deadly Disparities event to discuss the impact of COVID-19 in the Black community. I want to note that there is a survey link that's being dropped in the chat, or will be dropped in the chat. So please do take that. That helps us to understand how you, what you think about the event and maybe what's coming next for both of us. The Institute for Research on Race and Public Policy has had the good fortune of partnering with UCAN for other similar events in the past. And so I encourage everyone to check out our website, irppuic.edu, for that COVID-19 report and previous reports. Join our mailing list if you haven't. And if you don't already follow UCAN Chicago on LinkedIn, Facebook, and Instagram, it's a good moment to do so, to stay tuned for more UCAN DEI events. Again, thank you all for joining us, and I hope everyone has a good rest of the day. Thanks again to Claire, to Darlene, to Claude, to Ladarius. Appreciate your words and your thoughts today.